Webinar about compliant documentation and the Pregnant Workers Fairness Act. Today, we're going to chat about how to simplify your HR documentation process, specifically in light of the Pregnant Workers Fairness Act. Now, this might sound intimidating, but let's all breathe a collective sigh of relief because together we're going to tackle this and ensure you leave this webinar with a clear path ahead. And with that, before I tell you about the agenda, I want to share more about HR for Health. Here at HR for Health, we can help you do HR like you've never done. Of course, we specialize in HR software for non-HR people, but that doesn't mean we don't also work with seasoned HR experts to help make their process a little easier. Our mission is to be your compliance partner and ensure a safe and positive workplace for your employees. As a result, save money, save time, improve your company culture, and avoid lawsuits. And this is the agenda for today. So lucky for you, I just went over the first one, and then next we'll talk about the Pregnant Workers Fairness Act, the new hire checklist, documents, permissions, and some common issues that we see. So that mountain of paperwork, consider it shrunk to a mere molehill. Legal compliance, we've got it covered. With the help of our dental and medical HR software, you can slap an out-of-order sign on your worry machine. So pour yourself a cup of coffee or tea, we're not judging, and get comfortable as we dive into a discussion that's going to make your professional life simpler, smoother, and certainly more compliant. We're thrilled you've joined us today, and let's get started. It's time to wave goodbye to the HR worries once and for all. You're already on your way to never worrying about HR again. And to help alleviate some of those, Lauren is going to tell you more about the Pregnant Workers Fairness Act.
Yes, thank you, Taylor. I'm excited to be here today. I just wanted to kick off because this is a very urgent new law that just went into effect yesterday. So I wanted to kind of hijack this webinar, Ryan's webinar, just so we could talk about it, give you the basic information that you need. And then you can move on to the fun things with Ryan and see how our software can help you with this new law. So what it is the Pregnant Workers Fairness Act. So you'll hear me say PWFA throughout this. And what it is requires covered employers, so if you have 15 or more employees, to provide reasonable accommodations to a worker's known limitations related to pregnancy, childbirth, or related medical conditions, unless it would cause an undue hardship on you as the employer. So there's already a lot of protections in place for disabilities, pregnancy in general. This one specifically reasonable accommodations for pregnant employees. So just additional things that you have to keep in mind if you have a pregnant employee. And then just I wanted to mention an undue hardship is defined as causing significant difficulty or expense to your business. So I do want to say this is extremely hard to prove an undue hardship. So if you do want to go down that path, I highly recommend speaking to an HR specialist, legal counsel, just to make sure that you're protected. It is very hard to prove. So don't think, oh, I can just take that route because it's a hardship on your business. It's not that easy. So let's jump into the next slide. We're going to go over some examples of what a reasonable accommodation could be. So some examples that they provide are being able to sit or drink water, receiving closer parking so they don't have to walk as far to get to the office, having flexible hours, receiving appropriately sized uniforms and safety apparel, receiving additional break time to use the bathroom, eat, and rest, taking leave or time off to recover from childbirth, and being excused from strenuous activities and or exposure to chemicals not safe for pregnancy. So these are examples that the EEOC provides. Obviously, it's not the whole list. It could be anything that the pregnant employee needs to be accommodated for specific to their position. But these are just some examples so you can kind of get an idea of what this might look like within your practice. Okay, and then the next slide. Things to avoid. So we always want to go over what you shouldn't do, just to make sure you're not accidentally breaking this new regulation. So what can employers not do? So the first one is require an employee to accept an accommodation without a discussion about the accommodation. So what this is called is the interactive process. You really want it to be an open conversation with the employee about what accommodations they need, how you can accommodate them in the practice. It needs to be a back and forth, not just you saying, oh, here's the accommodation that I'm providing to you. The next one is very similar to discrimination. You don't want to discriminate against someone that needs an accommodation. You don't want to deny them a job. You don't want to deny them a promotion. Obviously, you want to treat them just like you would any other employee or applicant based on their skills and their position and not their need for the accommodation. So make sure you're not even subconsciously discriminating an employee that needs an accommodation. And then the next one is require an employee to take leave if another reasonable accommodation can be provided that would let the employee keep working. So you can't say like, oh, I don't want to accommodate this. Why don't you just take the full leave? If you can get them to keep working within your practice and find something that works for both of you, then you have to explore those options to keep them working before you require them to go on leave. You don't want to require them to go on leave in general. And then the next one is retaliating against an individual for reporting or participating in a proceeding, unlawful discrimination. So of course, you want employees to be able to raise their hand if they see something that they have concerns about, and you definitely don't want to retaliate or discriminate against those employees for doing so. Okay, and then next we're going to go over some of the common questions that might come up. So a lot of you might be thinking, what if I'm in a state that already has pregnancy leave requirements? So there are 30 cities and states that already have protections in place for pregnant employees. So if you're in one of those, it's most likely going to be more beneficial to pregnant employees. So you have to follow what your specific city and state recommends, but just make sure that you know what's required in your specific location. And then the next one is if you have 50 employees, what do you do if you have to offer FMLA? Are they the same? Are they different? So FMLA is the Family and Medical Leave Act. So this is actually 12 weeks of unpaid leave. It can be used for pregnancy reasons. It can also be used for taking care of family members to bond with a new child. So there's more reasons for a leave under FMLA. So they are different. Just make sure that you know exactly how they interact if you do have an employee that falls under both of those. Okay, and then next I'm going to jump into the next step. So what do you do with this information? What's required of you as an employer? So the first thing you want to keep in mind is making sure that you're training your team leads, your office managers, any department heads that you have on PWFA. Make sure that they know what reasonable accommodation examples are. Make sure they know how to handle those requests. The next is documentation. So make sure you have the proper documentation protocols for accommodations that might come up, adequate tracking for leave. So even if it's not a full leave of absence, even if they need to take time off for a doctor's appointment, or maybe they have morning sickness and they need to take an hour off in the morning, even though we know morning sickness is not just in the morning. So maybe they just need an hour off. You need to make sure that you're tracking that time as well, because we want to make sure that that documentation is in place. The next one is for new hires, so providing them with a notice outlining their rights. The next is the employee handbook, adding the PWFA policy to your employee handbook. Again, we want to make sure that we're communicating as much as possible so that your employees know what their rights are. The next is updating the posters in your practice, so making sure that employees can easily see in their rest break areas, again, what their rights are. We just want to make sure we're communicating it across all fronts. And then this QR code right here is actually some resources for training your supervisors. So I highly recommend scanning that so you can easily access it. You don't have to create a new training platform for them. You can just use the resources that the government provides for you there. Makes your lives a little bit easier, which we know we want to do just in general. And on that note, I want to hand it off to Ryan. She's going to go over how our software can make your life easier in general. So here you go, Ryan. Thank you.
Thank you, Lauren, for that information. So in Lauren's last webinar that we did, we discussed the importance of proper documentation, the forms that are needed through all stages of employment, and issues that can arise from not using a compliance-focused cloud-based document management system like HR for Health. Today, I'm going to explain the practical use cases that HR for Health can solve when it comes to document compliance. And let's get more time back in your day to focus less on maintaining employment records and get you back to what matters most, your patients. So documentation starts at the beginning of employment with an offer letter and all the new hire documentation that an employee must complete when they are onboarding. There are several documents that are required by the federal government and by each individual state. Outside of what is required by law, there are also several recommended documents to have a new hire complete to ensure your practice is protected. And keeping up with these documents and updates of these documents could end up being a full-time job. Not having these documents could leave you facing fines, penalties, and legal fees. With HR for Health onboarding and gathering of onboarding documentation for an employee is made extremely simple and user-friendly. Once an employee is invited to HR for Health and registers, they will receive new hire documentation for your state that the employee will be able to electronically sign within our software. The documents also autofill with the employee's information and information from your practice. So there is no need to spend hours preparing the new hire documents because, let's be honest, who has time for that? And no need for your employee to spend 2+ hours completing it by hand. They are able to complete the documents within 30 to 45 minutes. Some other perks of new hire documentation is anytime your state has a new form or an updated form, HR for Health will update the form and you will be able to accept that form onto your new hire checklist. And I'll show you what that looks like a little bit later here. There's no need for your office manager to go searching the internet at the beginning of each year or throughout the year to find form changes. And as Lauren mentioned, the Pregnant Workers Fairness Act update earlier, we have added the infographic to our new hire checklist for you. So you'll see that a little bit later as well, as we would any other document that needs to be updated to that new hire checklist. If you are an existing client with HR for Health, you can actually go ahead and accept that document and add it to your new hire checklist. And if you're looking to join HR for Health, this is something that you can look forward to. An offer letter is also sent to your employee from that new hire checklist, and that offer letter populates with the employee's rate of pay, their job description, working days, and other information you have input when adding your employee into HR for Health. They will electronically sign this offer letter as well as the rest of that new hire documentation. The new hire checklist also includes all federal and state mandatory documents, all recommended documents that are recommended by our legal team, and optional documents. All are there to keep you compliant and keep your practice safe. And you also have the option to add your own onboarding documents. So for example, maybe you have a waiver you need employees to complete or a training form like a sexual harassment certification. You can add these documents to the new hire checklist and you are able to require a signature of acknowledgement. Keep in mind that any document that you do add will need to be editable, so you will have to make sure that you have it, put it in a PDF editor in order for employees to actually electronically fill in each form. But if you just need a signature of confirmation, we have you covered there. And lastly, your handbook is also added to the new hire checklist for new hires to sign. It does get added as soon as you complete the handbook within our software. And since we're speaking of the handbook, we'll go over it briefly with how it works in HR for Health, if you haven't heard already. HR for Health's handbook software allows you to easily complete a questionnaire, and our software will take your answers and create a custom handbook that is compliant for your state and will include all the required and recommended policies. You will also have the option to add your own custom policies, and the great thing about our handbook software is you have the option for automatic law updates. This includes the new policy for the Pregnant Workers Fairness Act for states that currently do not have a pregnancy policy leave. With the automatic law updates, we do add the new policy for you, and the new version will automatically send to your employees to sign as well. So you don't have to take the extra time to do that, and you can save time in your day. And then once the documents are complete, you are able to review them at the employee level. They are also safe in our cloud-based system, and locating them is very simple in case you are ever audited. There is no need to go rummaging through files or worrying about if they've been lost. So that brings us to the employee new hire checklist. So outside of our management new hire checklist, each employee will have their own new hire checklist. After each employee has signed their documents electronically, you will be able to review the signed documents on that employee new hire checklist. This is the page where you can view the documents that were completed. You're able to mark them off as complete to ensure that all forms were filled out correctly. You just want to make sure that all of the information is there and that all forms have been signed. And you're able to take action on any documents that do require your attention. It's just another way that we help you stay on track and keep you organized. Next, we have job descriptions. So just when you think you've covered all bases with onboarding documentation, we do not want to forget about job descriptions. Having a job description for an employee is essential for an employee to understand their job role and expectations. This is something they can reference back to in order to ensure they are performing the job duties expected, and is very helpful when it's time to complete an employee evaluation. HR for Health does provide you with several industry-specific job descriptions that can be assigned to employees before they are added into HR for Health. This is the same job description that will populate into their offer letter that we talked about a little bit earlier. When an employee registers, they also need to review and confirm their job description in HR for Health. This will be time and date stamped and lives in their employee job description feature in case any questions or issues arise in the future. And if you're not convinced that HR for Health can solve your document problems, don't worry, our software has way more to offer. So let's talk about our HR for Health document storage. HR for Health has two features that are specific to document storage. This is the management documents feature, in other words, the documents vault. And we also have an employee level document feature for each specific employee. I mean, document vault sounds very official, right? HR for Health's document vault feature can help you easily manage all documents in one place. This feature includes all office documents, all employee forms, all former employee forms, and you also have the ability to add documents that should not be seen by other individuals. So maybe not be seen by the employee. So for example, do you keep completed termination forms for an employee? Do you need to keep accommodation records or waivers or any other private documentation? These types of documents can be added to our management document feature for only authorized personnel. Again, this means that the employees would not have access to those documents. You also have the option to organize the management documents into folders. So for example, if you want to keep all of the termination paperwork separate from your office documents, you can create a folder specific to that and label it termination documents. You might even want to include an employee specific name. Then you can add and upload documents into that specific folder. You can also move documents into folders. So if you want to just organize your whole management document section, you have the option to do that. And this ensures that they are easy to find, but in a stored and secure location. Other perks of the management documents is the option to filter. So you can filter by document, so who it was signed by. In the employee documents tab of the management documents, you can also filter to see all of the documents that are awaiting signature and by document type. This is extremely helpful if you want to see who still needs to complete their W-4 or I-9 form, or maybe their handbook during a new hire onboarding, as we know those are very important forms. You can search specific documents using our search function, and you can add or upload documents to send a document. And I'll show you how to do this a little bit later. We mentioned briefly when discussing the new hire checklist, but if you are uploading documents and you are hoping to send those documents out to your employees to complete electronically, you'll just need to make sure that they are editable. So making sure you're using that PDF editor to have fields that can be filled in. Our system will give you the option again to require signature, but it's really just a signature confirmation and a date stamp. Now, outside of that, our new hire checklist documents are all set to go. Those will be auto-filled and they'll be able to sign those perfectly. It's just if you're adding your own documents. Next, we have permissions. So outside of documents, having an efficient and simple way of delivering and storing documents is one thing, but what about protecting those documents and ensuring they are confidential? We also have you covered there. We have a sophisticated permissions feature where you can assign individual specific permissions to manage different features within our software for the only people you want to provide access to. So for example, do you have a supervisor who you want to manage employee timesheets but you don't want that supervisor to have access to employee documents because maybe they contain personal information. You can set that up in HR for Health, or maybe you have an office manager who is able to access all employees' documents except documents that are under your name. So maybe you have documents that you don't want them to see. You can set that up as well by only giving that office manager access to a specific employee list. And outside of the onboarding and ongoing documentation storage, HR for Health does provide other helpful documents to keep you compliant. With HR for Health separation documents, you will be all set with needed separation documents in case an employee termination or resignation. And with the feature, you can filter the documents by applicable personnel, so whether or not they're an employee or an independent contractor. Employee count, some forms only need to be provided for offices with 20+ employees. And then of course we have documents that need to be provided to everyone. We have separation type, so you can filter by voluntary or involuntary separation. So voluntary is if they leave on their own, and involuntary would be if you terminated them. You also have an obligation, so documents that are labeled mandatory, recommended, optional, or informational. And as always, we do recommend providing all of those documents. You are able to download the forms, print them off, and have the employee complete them by hand on their last day. These documents can later be uploaded back into HR for Health and added to a termination folder for safekeeping in our management document section. And if you are a client with HR for Health, we do suggest speaking with our HR specialist prior to any termination just to ensure compliance and ensure you're not putting yourself at risk when terminating somebody. All right, we are going to get into the software and have some fun here. I'm going to show you around. Let me get this going here. So the first thing we're going to take a look at is the new hire checklist, which we've mentioned a couple times. So in order to get there, you will go to Documents on the Management menu on the left, and you will select New Hire Checklist. This will show you the list of all of the documents that will be sent to your employee as soon as they register. Anything on here would be sent to them as long as they're part of this applicable personnel. So here you can see the name of the document, and if you hover over it, you can see a brief description. You can also click on the document name and it will show you the document itself. You have the applicable personnel, so whether or not it's an employee or an independent contractor. And yes, there are documents that should be provided to independent contractors. You do have the action process here, so some documents only require an employee's signature, where others require the employee to sign it and then the authorized user to take an action on that document. You have the obligation, so mandatory, recommended, and optional documents. Mandatory are mandatory both federal and by state law. Recommended are recommended by our legal team, and optional, of course, just optional. But we do recommend keeping everything on the list. We did mention that we do update the new hire checklist forms when they are outdated. And so anytime we update a form, you will see a little triangle on your new hire checklist letting you know. You can then go ahead and click it and accept or ignore that update. We obviously recommend that you accept that update, but you do have the autonomy to do what you want. At the bottom, you will see that Pregnant Workers Fairness Act document. So here we have the pamphlet with all of the information. You can easily add it to the new hire checklist by clicking here and clicking accept. All right, you also have the option to add a file to your new hire checklist. So if you do have a waiver or some form that an employee should be completing during that onboarding process, you can go ahead and add it to that new hire checklist. And that way it will automatically send to the employee as soon as they register. You can name the document, select an obligation. They won't actually see this, so this is really just for your information. You have the applicable personnel. So if it's only supposed to go to the employee, you would just select this box. If it should go to both, you would select both boxes. Action process, you would just choose what's applicable. So maybe the employee just needs to sign it, or maybe they just need to view it. From here, you can add a description, choose the file, and then click to require signature. Once you click save, it will be added to this new hire checklist list. All right, next we're going to go over our documents vault, so our management level documents. So going back to that navigation bar, you're going to select documents. You will then select all documents. So here you have 3 different tabs. You have your office documents, which is literally all of the documents, which is why the filtering comes in handy. You have your employee documents. So this is going to show you all the documents for each individual employee. And then you have your former employee documents. Right now in this tester account, we actually don't have any former employees. Retention is great, but you can see that you are able to use filters here if you ever needed to, filter by a specific employee name or status or document type. Going back to the office documents, let's go ahead and show you how you can create a folder. So if you ever needed to create a folder for termination paperwork, you can go ahead and click this add folder option on the right-hand side. You're able to name it, so termination paperwork, paperwork, click save. I have the folder here. And then what I can do is when I'm adding different files, I can click add file here. I can choose the file, I can name it, I can add a description, and then I can select which folder I want to put that file into. So if you are terminating an employee, they're completing those forms by hand, you can scan those into the computer and you can upload them here and put them straight into a folder. You do have filtering options here as well. So let's just say we wanted to find maybe a handbook. I can search handbook. It would come up with all of the handbooks that I have available. I can also filter by who a document was signed by. So if I just wanted to view the forms that Bailey has signed, I can view those here. I can also view by type. So is it an arbitration form? Is it emergency information? Things along those lines. And then one thing that we do get a lot of questions on is how to actually send a document. So if you ever need to resend a document to an employee, you do have the option to do so from here. So you'll see that underneath actions, you can click this send icon and you can go ahead and choose who you want to send the document to and require a signature. All right, next I'm going to go ahead and show you how to find your employees' documents, your employee new hire checklist. So if you go to the employee portion of the navigation bar, select documents, and then go to documents again. It's kind of funny, but it's on my profile, so I actually can't see my own new hire checklist. But if I go to Bailey, I can see her new hire checklist underneath documents. So here I can see all of her obligations, the name of the documents, the most recent form, and the status. So if I review a form and it's been completed, it needs to be complete by me, it will say pending completion. I can come in here and I can mark it off as completed. All right, and then of course, each employee has their own document section. So as you saw when we transferred to my account, here are all Bailey's documents. You can see the status of them, if they're informational, if they're signed, if they're awaiting signature, the name of the document, and you can actually download it. And then of course you do have actions to the right. So if you ever needed to resend a specific document to an employee, you don't just have to do it at the management level, you can actually do it at the employee level. So maybe Bailey has another W-4 that she needs to sign, you can just click resend here. All right, so the next thing that we're going to go ahead and go over is those permissions. So we did talk about the setting up of permissions to ensure that whoever you want access to have access to documents will have it. If you don't want them to have access to documents, you can go ahead and set it up that way. So we're going to go ahead and show that. So getting to permissions, you would go to management, you would go to setup, and then you would go to permissions. From here, you have default permissions that you can use. So these are the ones that we provide you. Employer, external user, office manager, and supervisor. These are pretty standard. And if you ever wanted to view what that is giving access to, you can click this little view icon here and you'll see. But creating a permission profile, although it seems intimidating, it's actually really simple. You just click the add button here. You can name the profile, so maybe no access to documents. And then here you can see that we have a company level management. So these are going to be all of these items here. So if you wanted to give access to, documents from the all documents section, certain departments, job descriptions, and you can hover over these tooltips. It will tell you what you're actually giving access to. But let's just say you have a supervisor who you wanted to give access to approved time off and to timekeeping, but really nothing else. You can just go down to this team management. And from here, you can literally choose access to time off. So to view, create, edit, or delete. And then maybe you want them to be able to approve or maybe manage their own. You can provide that access as well. You can also do timesheets here. So view, create, edit, delete. And you can also allow them to approve or self-manage theirs. We're going to leave that out. But this ensures that they only have access to these two items and not access to documents. Of course, you can give access to CE unit certifications, employees, all of the job descriptions if you'd like. But again, they won't have access to those documents. And then once you click save, you will be able to assign that permission profile. And if you as the employer did not want the person to have access to your information, so you're like, yeah, I want you to oversee all of the employees except for me, you can either apply it to subordinates. So maybe Bailey Jones is able to oversee Porter and Maverick, so subordinates would work, or you can do a specific employee list and you can choose Porter and Maverick from that list. Once you are done, you would just click save and you are good to go. All right, and then the last thing I want to show you is something new. It is our resource center. So here in the bottom right-hand corner, you will see our HR for Health Resource Center. This is where you will have access to law updates for your state, as well as any federal updates. So this tester account is for Georgia, so it's going to have all of the Georgia updates. You also will have access to all of our feature release information. So we are constantly updating our software to ensure that it works great for you and seamless. So anytime we have new things coming out, you can view them from here. And then also we have some resources for you. So you do want to make sure that if you have any questions, you take a look here. It's filtered, or you can go through each different subject. So if you have questions on adding employees or maybe employee documents, you can go ahead and select it. You'll have some FAQs here as well as video tutorials. All right, and so that is everything on my end. I'm going to go ahead and get back to our slide here and kick it back to Taylor.
Thank you, Ryan. And I would like to start to wrap up this webinar by posing a few questions that I've seen in our chat. The first one is, does leave under PWFA have to be paid?
Ooh, yes, I'll take that one. That's a great question. It can be very intimidating, but it is not a paid leave that you as the employer have to pay for. So I'm sorry if I gave anyone a heart attack about that earlier. It is not a paid leave. So hopefully that helps a little bit.
Awesome. And do I need to track time off even if it's unpaid?
Oh, yes, good question. So as I mentioned earlier, yes, you want to make sure that you're tracking any paid or unpaid time, even if it's for an hour for a doctor's appointment or if they need to take time because they're not feeling well. Make sure that you have all of that documented. And we do have a full time off tracking, so it automatically tracks balances. You can add in requests. So if you're a current client, make sure you're using our timekeeping and time off. Just, again, makes your life easier in general.
So what you're saying is they would not have anything to be worried about if they just have our software.
They need our software.
Exactly.
So the easiest way to learn about our software is you can email us, you can call us. We have a website, we have social media, and we also have a QR code to generate a free federally compliant employee handbook. We have a ton of resources, but your lives would just be a lot easier if you had our software. And you would probably sweat a lot less at night. So with that, thank you everyone for being here. I hope you feel a little less scared of all the changes that are coming, but also know that you have a friend in compliance with HR for Health. Consider our software. And if not, if you have more questions, please reach out to us. We're happy to answer any of them. So thank you, Lauren and Ryan.
Bye.
Thank you.